Fever is something that really concerns parents. Now, it's important to know that fever in itself is not harmful. It's actually a very normal way of the body fighting infection. And in fact, it indicates a normal immune response. For us, it is the cause of the fever that's most important. Now, the first thing I should mention is, what is a fever? It is any temperature at 38 and above. The only time that the number of the fever itself is important is if the child is less than 3 months. If they're less than 3 months, regardless of how well they are, they should always be seen by a doctor. For children older than 3 months, it depends on how they're going, what their symptoms are, and what the potential cause of the fever is before you get too worried. Now, some symptoms of fever include that the child can be hot or sweaty, sometimes have the shakes. They can be breathing fast, be a bit cool to touch, even though they feel very hot, and they can be very miserable and upset. Occasionally, fevers can cause what we call febrile seizures, which is a fit when the child has a fever. This can be very scary for parents, but mostly it's harmless and resolves very quickly. But you should see a doctor if this happens. A few things that we don't recommend parents do when children have a fever is pop them in a cold bath, or to not give them any medication because they're worried about masking a fever. So what are some things that you can do if your child has a fever? For me, the most important thing is to make sure that your child is comfortable. So medication like paracetamol and ibuprofen can be really helpful when a child has a fever. Not to bring the temperature down, because like I said, the actual number of the fever isn't the main concern, but the paracetamol and ibuprofen can help make them feel better. And if they're feeling better, then they're more likely to drink and be comfortable. Paracetamol and ibuprofen works really well if taken together as well. So just check with the pharmacist that this is safe for your child and make sure that you're giving the correct dose in the 24-hour period. But make sure that you're staying on top of their misery with some pain relief. The next thing is to keep up the fluids as best you can to avoid dehydration, and I'll chat more about that later. And the last thing is to think about what could be causing the fever. If your child has a cough or a cold, sore throat, or other symptoms that could be causing a fever, you don't necessarily need to see anyone unless you're worried. But if there is no cause at all after 24 or 48 hours, it's a good idea to see a doctor at that stage. Other times to see a doctor include if your child is less than 3 months, as I mentioned, every few days if the fever is continuing or longer than expected, or if there's any change in symptoms. And of course, if there are any symptoms that you are worried about, or any of the following symptoms. Things like a rash that doesn't disappear when you press it, features of dehydration, if the pain doesn't improve with paracetamol or ibuprofen, if there's any heavy breathing, there's neck stiffness or your child is refusing to look at the light, or if they're very tired. Now stay tuned, and I'm going to chat a bit more about viruses and dehydration.